Welcome. I'm Erika Mallon, Executive Director of the Aspen Institute Arts Program. And on behalf of myself and Linda Lair, Director of the New York Public Programs, thank you for joining us for the conversation with great leaders in memory of Preston Robert Tisch. Our leaders today are award-winning playwrights, a pioneering medical expert, all discussing our ultimate leaders, our frontline workers. Today, we bring together art and medicine to hear the stories of our frontline workers, the toll that it has taken on them during this pandemic, and discuss what we can do to serve them as we continue the fight. So I am very pleased to introduce our panelists. We are very honored first to have Jessica Blank and Erik Jensen, co-creators of the docudrama The Line, which was produced by the Public Theater virtually over the summer. They will be in conversation, and we are very pleased to have Dr. Aletha Maybank, Chief Health Equity Officer and a Vice President of the American Medical Association. And our moderator is Rachel Jones, journalist and contributing writer for National Geographic. Thank you all for joining, and thank you all in the audience for joining. We will have a Q&A. You can submit your questions during the panel or as we enter the Q&A through your Q&A box on the bottom of your screen. And when the panel ends, Linda will come back to facilitate the questions. So now I am going to turn it over to you, Rachel, and thank you all again for being here.
Thank you so much, Erika, for that introduction. And as she has mentioned, this event is billed as a conversation with leaders. But as leaders around the world, leaders of countries, leaders in the fields of research and science, are debating and trying to sort through what is the way forward for us after this dramatic year of trauma and loss. I think the clip that we're about to see from the documentary play, The Line, will really give us a window into who the real leaders are during the COVID-19 pandemic. So as we watch this clip, I think you'll soon find out why, about 10 minutes into watching this play, I was absolutely riveted. So let's take a look at a clip from The Line.
We heard about it when it was in China. Something happening over there.
We started talking about it in February, but I was just focused on surviving my first intern year. I wasn't even wearing a mask back then. You just feel like you're being dramatic.
The information that we had was that it wasn't affecting healthy young people. And I just thought something that's far away is far away. And right now there are people in front of me that need my care. And I can't be worried about something that's not here yet. That's the government's job.
I think mid-January, I said, okay, this is going to be an interesting ride, because look at New York City. I mean, how many people ride the trains? How many people ride the buses? We're all just keeping a wary eye.
I pay attention to the news. As paramedics, you're always looking at different articles and going, yo, check this study out. We've been talking about COVID for a minute. Like, yo, check it. China has another thing going on. Yo, we got to be careful, because you got to understand, like, we went through Ebola, right? You had Zika virus, you had Ebola, you had the West Nile, you had the H1N1, SARS. We were like, yo, what if it comes over here?
I left my last job at the end of December, and I took February off to go to Southeast Asia for 5 weeks. Vietnam, Indonesia, Thailand, and Singapore. Wuhan was happening even before I left, but I studied statistics and epidemiology for many, many years, and the data that was coming out, I'm a healthy young person, and Vietnam had a total of 16 cases in the whole country. But my family were calling me and said, get home ASAP, they're about to shut travel down. So I went from there to Hong Kong, and then Hong Kong to the US. And there was nobody on my flight. In the airports in Southeast Asia, there were multiple checks. People checking your temperature, screens that looked at the infrared, random people stopping you and asking if you had symptoms. But in the US, I just waltzed in. I could barely even find a sign saying, hey, if you have a fever, stop somebody. No temperature checks, nothing.
If any of you watching remember the powerful conversations that occurred in the documentary play Exonerated a few years back, then you'll understand the force behind this latest creation of Jessica Blank and Erik Jensen. They brought us The Line as a series of conversations with people who are on the front lines of the COVID-19 pandemic. So Jessica and Erik, it's a privilege to be talking to you. And I'd love it if you could start us off by telling us what exactly fueled your interest in producing this play.
Well, first of all, I'd like to thank Erica for having us here. It's really an honor to be at the Aspen Institute. It's an honor to be here with my fellow panelists, and an honor to be asked questions by you, Rachel. So thank you for that.
And yeah, I mean, I think so. When in March, our most recent at the time documentary play Coal Country had just opened at the Public Theater. That was a play based on interviews we did with surviving family members of coal miners who were killed in the Upper Big Branch mine disaster in West Virginia in 2010. And that opened March 3rd. And, you know, as we all know, everything around the 11th or 12th shut down, right, immediately. And it was in the theater world, it was really over the course of a day. Like we went from, you know, everything in full action to like just closed. So we were speaking to the public pretty much every day in that window, just trying to figure out what was going on, if theaters were going to reopen, what was going to happen to our show. And we were sort of paralyzed and freaked out, as I think most people were in that moment. And we were approached by an organization called the 24-Hour Plays, somewhere in there. They were doing these viral online monologues, and they were approaching playwrights to create them in 24 hours. And we said, great, we would love to do it. Can we do it in our style? By now it was like late March, and do an interview. And they said, sure. And so we went in search of a nurse, a New York City nurse, who would talk to us about what they were experiencing at the time anonymously. And we did that interview, and it was, I mean, it was the height of
what she went through and what she described just in terms of work. I come from the working poor and was heavily influenced by a guy named Studs Terkel, who wrote a book called Working many years ago that offered me a window when I was a young kid into what it's like to work different jobs. And the amount of physical degradation in her body and in her soul and in her spirit was astonishing to me as an artist. I didn't know how she had the strength to get up every day and do the physical labor that she was doing just to keep people alive.
And this was at the point where they didn't have PPE, like she didn't have a mask some of the time. I mean, it was really, really powerful and intense. And as we had found her and went out looking for that material, we realized there was a lot more. And so we called the public and we said, look, we have no idea what the theater is doing or what's even happening, but we have this idea, and what if we did some kind of rapid response thing? You know, usually our plays take anywhere between 2 and 4 years to make. There's a lot of journalistic style research that goes into it. It's a long process, and theater takes a long time in general. But online, we figured maybe we could do this in a way that is actually really responsive to the moment. And they called us back a couple of weeks later and they said, let's go, like we're in. And
all in all, it took us about 2 months to do the interviews and assemble the play. And then, you know, it ended up getting 50,000 views online, which is like, you know,
those are big numbers.
Those are big numbers for theater. It takes a long time to fill a theater with that many people.
Let me ask you about how you are able to sort of sort through some of the more powerful conversations. As I told you during one of our prep calls, watching this halfway through, you begin to think this can't be real. The intensity of the conversations that you're having. How do you decide who you're going to go with in a creative process like this?
In a certain way, that decision-making is some of the most difficult decision-making in making a piece like this always, because we always talk to more people than will wind up in the play. And every single one of them is extraordinarily compelling. So we talked to about 20 people for the line. We did outreach to a much larger group of people, but we wound up having in-depth, like 3-hour interviews with about 20 people. And, you know, each one of them could have been their own play by themselves, right? So, it was extreme, and we did those interviews over the course of like 10 days. So it was very intense. we were taking in a lot. But I think,
Yeah,
you know,
I was traumatized by COVID. I became a shut-in in an extreme way. And, you know, the play was, for my part, an effort to understand what was happening in the city and to make sense out of it. And, healthcare workers are nonpartisan. They don't ask who you voted for when they're trying to save your life, you
Right.
know? And so, I was being motivated by that the whole time that we were doing it.
And I think, you know, once we were sort of emerged from the emotional intensity of doing the interviews, what we were really looking at, and what we always look at with this kind of work, is individual stories that then, when you, in aggregate, when you put them together, tell a larger story, right? So we really, you know, some of our aims were, in addition to just compelling stories and the intensity of the material, we wanted to paint a picture of New York City.
So
right?
it needed to be representative.
We wanted all healthcare professions, all frontline medical workers represented in the play. We were able to find one respiratory therapist whose story didn't make it into the play, which we were sad about, but we have EMTs, paramedics, nurses, doctors, right?
I wish we'd talked to some janitors and some people who do the cleanup too, because they're underrepresented in the public's imagination. And
we had a lead on a custodian who had become an EMT, but he decided he didn't want to tell his story at the last minute, which was unfortunate. But yeah, we wanted to be representative. We wanted to be representative in terms of people who worked at private hospitals, people who worked at public hospitals, right? Income disparity, the way, you know, and it was moderately clear to us at the beginning of the process, and then really explicit as we started doing the interviews, the vast disparities in healthcare that existed in New York City through COVID.
Before I move to Dr. Maybank, I think one thing I wanted to ask you about was whether or not you were able to detect a sort of a common theme. And if I had to pick one out, what astonished me the most was the sense of obligation or responsibility in each one of these people. Incredible stress, incredible challenges that they're facing, and yet you didn't get a sense from any of them that they were running from this challenge. They all seemed to. Can you talk a bit about what you saw in that regard?
Well, I mean, just coming from, again, I work from a very sort of childlike place in myself. But, you know, as a 14-year-old, I wanted to be an astronaut. And I think if I saw this play as a 14-year-old now, I'd want to be a frontline healthcare worker. You know, I have no marketable skills. I write and I stand in front of a camera and talk. And, you know, but, you know, the most important thing for me was just getting out of the way and letting their voices come through. You know?
Yeah, I mean, I think it was really, I mean, in terms of our documentary work, often we are coming from outside, from a different place. We travel to do the interviews. We go and talk to people who have lived through something really different from anything we've ever lived through. And this was a really different experience. This was we did all of the interviews on Zoom from our house. We were talking to people about, obviously we haven't worked as frontline medical workers, but a crisis that we were intimately involved in our city, right? We lost people and you know, it was very close to home. And I think, so we were sort of working through our own experience in making the piece as well. And one of the things that was incredibly nourishing and edifying and transformative was seeing exactly what you just articulated, which was this sense of showing up and this deep sense of profoundly committed care that motivated every single person that we talked to. And we gradually realized over the course of doing the interviews that care is really a radical force, and that it is the antidote to so much of what we're seeing, of the bad stuff that we're seeing around us, right? That like that commitment to show up and care for people diligently, no matter what, is really what we should be doing, right? It could be a North Star, I think, for all of us.
I think life is better when we lead with that.
Yeah.
Absolutely. Dr. Maybank, I wanted to talk to you about this issue of stress. I think we've all had such an incredibly stressful year, juggling schedules, changing the way we live and the way we operate. But when it comes to the frontline worker and the people who are literally catching the shrapnel of this on a day-to-day, moment-by-moment basis, what does the public need to know about the mental health impact on the frontline workers?
Yes, so thanks for the Aspen Institute. An honor to be on this panel as well. And before I even answer the question, I just want to say that, Jessica, what you said to me was actually extremely powerful in terms of the care and the need to have care at the forefront and what it means to show up and care. A lot of the work that I do and lead for years has been around injustice, right? And making injustice visible. And so art of any form does a fabulous job at doing that. And it's such a need during this time to have our artists of all types to working together with us as healthcare workers to elevate all the injustices that do exist, to make them visible. Because oftentimes, especially even us in the medical community, we hear a lot of statistics, we hear a lot of numbers, but they need to be qualified, and we need to hear the stories. And we know in the space of changing policy and changing hearts, that folks need to hear the stories. Numbers don't tend to move people, but stories do. So I really want to thank you all, for the work that you're doing. And then also you're recording history, and I think that's a really important part of any kind of response as it relates to epidemics, and preserving that history so that it doesn't become invisible, because that over time can cause trauma. And we see that play out in many different ways. And it's hard for me not to be transparent to the moment in time. And I paid attention to TV last night, as many people did. And when you start to hear and realize that folks are making history or working to make history invisible, that has traumatic impacts. It has mental health impacts for us all as a nation. And I think the more that we can, show up, absolutely care, but absolutely also be very truthful and transparent about what is actually happening, is helpful in terms of creating solutions. It's helpful to moving forward, to having systems that are more responsive to the mental health of folks. I'm at the American Medical Association, so we work a lot with physicians, 210,000 physicians exactly in terms of our membership, but we're engaged in many different ways. And we've been hearing, the experience of physicians firsthand. And I'm a physician myself, so I have many friends. I'm not on the front line per se in that way right now. But we've been trying to definitely share the information, elevate the voices, oftentimes, again, that aren't heard at the policy levels, so that these folks and these healthcare workers can get the resources that they need as it relates to whether it was PPE, all types of things, ventilators, whatever it was. I mean, you all heard the stories, and all the things that folks didn't have that they usually have right at the tip of their fingertips, literally like gloves. And so that creates a feeling of helplessness. It creates anxiety, of course. We have collected evidence and have done surveys of physicians that definitely tell us that they're reporting depression more so now. And they're really have a level of concern about, the experience of their loved ones, and you don't need data to tell you that. The stories and people will tell you that of, not only are they concerned about exposing themselves, but then what happens when they get home, and that all creates a lot of anxiety. And then the other piece of like the experience of the healthcare worker, and really more specifically, especially the physician, is just there's a financial stress to it, especially for those who have been in private practice. And there have been situations, and more so, of where folks have had to lay off their staff. They're having to apply for federal funds in order to figure out, how to survive. And then for those, other frontline workers who may not have their own private practice or just in healthcare settings, still it's a financial burden in many ways, because there are many situations that are happening at their homes that they haven't had to deal with before, whether it's figuring out, childcare, or how are they going to help support their children as it relates to school. All of those things, have compounded on one another, and is really the experience of the healthcare worker at this point in time.
No, I don't want to set up a sort of a women have it harder than men conversation, but I do know that in some of the early discussions of research or attempting to look into the mental health impacts, there is concern that women are dealing with the brunt of these impacts, because in many cases they're having to double up, triple up on their workloads at home and at work.
Yeah.
So can you talk a little bit about why we need to sort of keep that on our radar screens as well?
Yes, absolutely. I mean, I think the experience of women, who definitely, and I don't want to push, men out of the way, because there are many men who are caretakers at home as well. But there you go. But the reality is, is that many women, more so, are definitely trying to figure out how to pull all the pieces together. And the reality is our policies in this country are not set up for care, as Jessica mentioned. We don't have, paid family leave. We're one of the only industrialized countries that doesn't. We don't have that. We don't have universal health care, for goodness sake. So there are many things that place burdens on women. And then the other area that I'm really focused in is racial injustice and inequities. COVID definitely pulled off that scab. These inequities and injustices have been around for a long time, since really the beginning of this country. But it's really shedding light on, and we're looking a lot at the experience of physicians of color. And they're more likely to see patients who have had COVID, because they're more likely to see Black and brown patients. They're more likely to be exposed to somebody who has actually died of COVID because they're of color. And so, there are many, I guess, nuances per se. I don't know if it's nuances, but very clear particulars that we have to pay attention to and keep our eye to. And while we're focused on definitely supporting the entire healthcare care workforce, we also know that those experiences within it can differ throughout it.
Jessica and Erik, I want to go back to you, because I wanted to be sure to ask you. I don't know if it's because you picked just a bunch of great actors and actresses for this play, but something else that I noticed was they all conveyed so brilliantly the sort of almost detachment, the out-of-bodiness that frontline workers sometimes have to have in terms of talking about the horror that happened today, and then 15 minutes later another horror happened, and then I had to get up the next morning and it happened again. So can you talk a little bit about what you saw in terms of the coping mechanisms in frontline?
Well, my uncle was an ambulance driver. He was where they were in North Dakota. You were in the fire department and an ambulance driver. So he was an EMT and a fireman, because they have, I guess there's less buildings there. But so it hit home that way. I especially related to the experience of EMT, because I was around when these guys would come back. I lived with my uncle for a while. I was around when these guys would come back after losing somebody, and Oscar really hit home for me in my heart. That's where I write from. So yeah,
and you see that. I mean, we saw it in the interviews that we did, right? So for me, as directing the piece, it's really a wonderful gift to have been able to interview the real people and then work with. We did have an absolutely extraordinary cast, actors of that caliber, and be able to convey the reality that we perceived in the interviews, right? So that it's not an actor imagining what it might be like. They actually really have a lot of real information to draw on, and it's something that we saw in the interviews. I mean, we did these interviews in late May. So people were still, the worst of the peak was over, but people were still very much in it. And so that quality that you're describing was something that we saw in the interviews, and Erik recognized it from having seen it in his uncle as a child, right? It's like people
so much, but there's so much under the detachment.
That's right.
When there were sections of the play we had to cut about people going home and showering the COVID off of them, and showering the day off of them. and there's so much loss and grief too there that we haven't even begun to deal with as a nation, especially in communities of color. So there's a lot of work to be done. When this difficult moment in our nation's history is over, we all got to get to work, and we got to do it together. It's a lot of work.
And that's something that people really spoke to us about, right? It's like, okay, yes, I'm feeling all of this. I have this experience, and some of this made it into the play as well. I have this experience. I lose this person. They fall to the floor in front of me, and I have to see them through that. And then I have to go back out on the floor.
Yeah.
Right.
And creates lots of anxiety for people, definitely, in the healthcare community and in talking to folks and figuring out what to do. I thought what was also really powerful in the clip that was just shown, and it kind of demonstrates this generational memory that we have that gets passed down. And it was when the individual was talking about Zika and Ebola and all of these other kind of threats, right, to our country or to our health. And they're not in the distant memory, the ones that he mentioned, but they're in the memory, and how that affects how. So you can imagine during a time like now, where you have COVID that, literally affects every single human being on this planet. What trauma is that going to create over time? We don't even understand yet what the downstream effects or the long-term effects are going to be on the healthcare workers for sure, especially the ones that are in training. We have med students who aren't even in the hospital. They're not in schools. They're not in. And how do you train to be a physician? They're figuring it out. But how do you train to be a physician, to care for people, to put your hands on people in the ways that are needed in order to fully understand and care? So I just think it was a really powerful way also of hearing that kind of transgenerational trauma that is passed down in the stories of talking about former threats that happened to this country.
As we move towards the Q&A discussion, I wanted to bring up the fact that we're hearing so much now that we need to brace ourselves for the second wave. And so Jessica and Erik, as you've mentioned earlier, on other creative works, you get to spend a couple of years pulling together an Exonerated or some of your other pieces. This one has been quick. You've had to have these intense conversations with people who've been traumatized. You've endured just mindless stress. So when you think about maybe doing part 2 if you can even imagine that, what are you prepared to see? Where are we going in terms of understanding what these frontline workers are dealing with?
Let me just say one thing, and it goes to something that the doctor just said now. I can tell you that the look in some of the frontline workers' eyes, the only thing I can compare it to is we did a play about Iraqi refugees in Jordan who had escaped the war and gone to Jordan. And that is the look that I saw in at least half the eyes that I made contact with over Zoom. It was a similar look. There was a vibe that was hollowed out and a haunted vibe. And as a PTSD person with PTSD in recovery, and I'm doing great. Most of it from 9/11. There's a long road ahead for a lot of people. I can say that from a personal perspective. So.
Yeah, and I think, what a part 2 of this would look like. First of all, it would depend when we were to do it, right? Like if we did it in the middle of the winter, it might look kind of similar, right, to the play that we've already done. If we did it further down the line, I think that is, if we followed up with some of these same people, I think what that looks like depends a lot on the choices that we make as a society over the next few years, and particularly over the next few months, quite honestly. I think that, we have some opportunities here, because in crisis, when systems are coming apart, there are opportunities to build new and different systems. And there are opportunities to build systems that actually do build care in for people, that build mental health care in for frontline workers, that actually give people resources, right, that draw upon the incredible expertise that exists out there and put some of that in place. So there could be a part 2 of this that is about recovery, or there could be a part 2 that is more of the same,
or a part 2 about the federal authorities that failed New York City on a federal level.
Yes.
Like that.
Well,
like
that could be parts 2 through 26.
Yeah. So
Yeah.
there's records and there's transcripts. So maybe part 2 is a couple years away, but I'd be happy to do that.
Dr. Maybank, as you think about a second wave, bracing ourselves and sort of regrouping or trying to look ahead, what would equity look like when it comes to providing supports, creating policies that support frontline workers?
Yeah, so, this is one of those things that's almost hard to imagine when we've never been a society that really has structured itself or had systems that even were created for equity. And so to imagine that, I think, is going to be the work that needs to happen, and to figure out how to actualize it as well. Not only imagine it, but how to put it forward. And from our context, we really talk a lot about having an anti-racist and an anti-racism lens to the work that needs to happen moving forward, and really disrupting and recognizing fully the current system really is rooted and based on a myth about the hierarchy of people and the value of people based on skin color. And we have to come to terms with that as a country. And if we don't come to terms with that, we're going to be really challenged, and the lens of, and I'm not talking about, when I say white supremacy, not the folks that are visible and in the streets and all of that. I'm talking about that lens of what I just said, the hierarchy of value. If we don't challenge that, it's very hard for us to fully overcome our power systems of racism, of which many systems have been set up, of gender oppression, you asked about women earlier, and sexism and ableism. All of those come through a lens of like white supremacy and patriarchy. We have to be able to challenge those and talk about them, name them, and then figure out how are we disrupting all of that. And that's the hard, deep work of this.
Absolutely.
In the interim, there are many other solutions that we can have, but I like to talk about root causes.
I would love to ask Jessica and Erik very quickly, if you could mention the most memorable conversation you might have had.
Oh boy,
It was with Oscar, the EMT. He worked so hard to bring somebody back to life, and the guy died on his stretcher in the hospital because there were no beds available.
That one was a real heartbreak, because he talked about, in New York City, EMTs are known to go the extra mile, right? They're allowed to bring people back from asystole, from no heartbeat, right? And to take as long as they need to. And in COVID, their time was cut down to 20 seconds, right?
20 minutes.
20 minutes. Mm-hmm. And so he had a patient who was about to hit the 20-minute mark, and they got his heartbeat back right at that moment. And so there's this huge moment of triumph. They get him to the hospital, right? It's like, okay, finally we're gonna be able to save somebody. And then the hospital was at capacity and they couldn't admit him, and the patient died. That, I think you look at stories like that where there's that much opening for hope, and then there's another systemic thing that shuts it down. Is like, it was really moving and intense.
Also say for me, as like a cis white male, like, we wrote Exonerated 20 years ago. I thought I was modestly woke. This woke me up to a whole other level of systemic racism in our society. It really shook me, what I saw,
And that permeated most of the interviews. And I think that was, that's something, if you don't work in healthcare, a lot of that is, and you're white, right? A lot of that winds up being invisible and sort of seeing the vastness of the racial disparities in the healthcare system was really very intense and moving for us.
I see a couple of questions here. One in particular I find interesting, and it's that there's another frontline group that we need to talk about and that would be those working in the childcare sector. And it's a critical infrastructure piece of this discussion. And Dr. Maybank, I wonder if, again, we could talk about this issue, and not just for mothers, but for fathers as well. The issue that the burden of worrying about childcare also adds to the plate of people on the front lines.
Of course, childcare and school care, and then you work. So you worry about. So there's the folks who are providing childcare, the school teachers who have to go back to school or are being asked to go to school potentially, and not only the risks in terms of like having to care for children who are in their classrooms or in their childcare, but also how are they protecting their own selves, and then also what happens when they go home. And all of these, it can tear a person apart emotionally, because for the most part, I believe that people want to do good and they want to do the right thing. They want to show up in a very caring way. But when you start to put folks in those types of conditions, they have to figure out, what are you going to prioritize, right? And we've seen many people retire from the school system. We've seen people retire from the healthcare system and the public health system, because those types of decisions become too difficult. Now, granted, not everybody has the privilege, to retire or leave their job, unfortunately. And so those are the other really frontline workers, the essential workers, the expendable workers, per se, who have, for, again, reasons of structural racism and all of that, are forced into having to have these types of jobs in which they are exposed more. And they are, for that reason, are at risk for dying more as well. And so it comes down to, again, how do people have freedom, really, and don't have freedoms in this country? And this, I think, what COVID really shows is that space and that difference of power, conditions, resources, and opportunities again. And if we don't have optimal abilities in those four things, it's really hard for us to achieve optimal physical health and optimal mental health. But it's very clear that there are people who have that opportunity, and there are many people who don't.
There's another question here for Jessica and Erik, and they're asking, does the reach of the virtual play allow for more effective advocacy on issues like family and medical leave or public health equality? So do you feel that this format is much more powerful than bringing it to people in another form?
I think it's a great question. I think it's differently powerful, right? I think there is a way in which, we're theater makers, so this is our bias. There is a way in which nothing is ever going to replace breathing the same air in the same room in the same moment as we're all experiencing the collective experience of a play, right? And at the same time, the theater as an industry has been struggling for quite some time with barriers to access and an economic model that is exclusive, right? And where audiences are, by nature wealthy, they're aging, they're mostly white. That is a real problem, right? And that the theater has been dealing with. Plus, also, there's even just the geographic nature of it, of you have to be in New York City to come see a play at the Public Theater, right? So I think, one of the things that the theater industry is learning from this moment is that there may be, when we can be in live theaters again, a hybrid model that gives us the best of all worlds, where there can be live theater, but there also can be streaming broadcasts of plays, so that what was it, 40 countries or something like that? The line was seen by people in many, many countries, by people all over the United States, by people that we never would have gotten the chance to communicate these stories to otherwise.
Yeah, the other thing about it is that I'm a big believer in the living newspaper aspect of it. We're having a depression right now in New York. Technically, we're in a depression in New York City, and I just think I think it's kind of neat that we're using something that they used in the 30s during the WPA projects to promote greater health and well-being. Not only in body but in soul.
And the online model can be much quicker and more responsive than producing physical theater can be.
Anyway, that's it.
And New York City was very. Oh, I'm sorry.
Go ahead.
I bring that up. So the work, I used to be a deputy commissioner in the New York City Department of Health. And so we relaunched what they called neighborhood health action centers. And it was part of the neighborhood health center movement. It was the evolution of it. That was in the early 1900s during that same time. And so these buildings, when you look at them, in the basements, there are stages. And so they used to do plays and different forms of art for the community, but it was part of that same movement. So, and it was post the war. So, art has always played a valuable context and connection to health and promoting health.
And I think it will also fuel a word that was used a bit earlier, the opportunity to take advantage of the lessons that we've learned, the knowledge that we've gotten about these impacts, these stressors on frontline health workers, and to create new ways to empower them, to give them the sense of having a voice, of being able to guide their own direction, have a sense of empowerment in this. And I just wanted to say that, again, the opportunity to talk to the creative forces behind the line has been an incredible window for me as a journalist. Voices are always, they're my stock in trade. Hearing the experiences of people on the ground and what they're going through has been how I've lived my life as a journalist. And this is one of the more powerful examples of what having people use their voice can do and how it can help. So I'd personally like to thank the Aspen Institute and the participants in this webinar for having a discussion that I hope will get us through not only whatever the second wave of COVID-19 might be, but also coming out on the other end with a far greater understanding about public health, about community, about what prevention means, and how it can be a positive tool for all of us. So thank you, Dr. Maybank. Thank you, Jessica and Erik, for participating in this webinar.
And on behalf of the Aspen Institute, I'd like to thank all of you for putting together what I think is a very important program. And we should all probably reconvene again and see where we are at the end of this year. So thank you all, and thank you to the audience for coming and joining us.